All right, on the program today, we're going to talk about Botox.
Yeah, Botox. It has become a very popular way to fight those wrinkles that's not painful. Dr. Raul Rodriguez is here to tell us about Meso Botox. How are you?
I'm doing great.
Good morning. It's Meso, not Meso, right?
Well, it's Meso.
Oh, it is Meso.
It's Meso.
Oh.
We were debating about that. He said Meso, and I said it's Meso.
Yeah, and then
I wanted to be right, doctor.
And then I said Meso, sorry.
You said Meso, sorry. Okay, well,
Okay.
tell us about Meso Botox. How does this work?
Well, Meso Botox is a combination of the very popular Botox procedure with mesotherapy, a procedure that originated in Europe designed to remove wrinkles, fine lines, and make the skin younger looking.
So I can get that done today?
I came here just for you, Scott.
Good. All right, I've got quite a few that I could get taken care of. We get between you and Dr. Jay Burns, the plastic surgeon. He'll take care of this, and you can take care of these. Would that be good?
Oh, we can take care of a lot of things, but I don't know how much good we're going to be able to do on you.
Dr. Raul Rodriguez,
That's
everybody.
why I love Dr.
Yeah,
Raul.
that's why he comes back all the time. All right, we're glad you're here.
Good to be here.
Take that knife out of my back, will you?
There it is.
All right.
Botox gets a boost. Up next, how the popular injectable and mesotherapy are used together to smooth away wrinkles.
Plus, as the graying of America continues and
Welcome back, everyone. Some are calling it a facelift in minutes, and the instrument used to perform it is not a scalpel, but a needle. Meso Botox combines the science of mesotherapy and the popular injectable Botox to erase very small wrinkles anywhere on the face. And Dr. Raul Rodriguez of Rejuvenex Medical is here to tell us more about it. And good to see you again.
Well, it's good to have me back.
Well, it's so great to think of something where you don't have to think about all the pain involved.
Absolutely.
So, and this seems like, you know, this is something that so many people can do. It's a viable option.
Oh, absolutely. Most of my patients that come to me for beautification, they don't want downtime and they don't want pain. And this is a perfect option for them.
Well, first explain, what is mesotherapy?
Well, mesotherapy is an injection technique where I can inject a combination of nutrients, vitamins, antioxidants directly into the skin to help alleviate or even eliminate completely fine lines, wrinkles. We literally take the skin back in years, make the skin physiologically and structurally younger so that you look younger without having to have a facelift.
And we're looking at some before and after pictures here. Explain how mesotherapy works in conjunction with Botox.
Well, Debbie, Botox simply relaxes muscles and then allows the skin to relax on its own over time, the same way as if you took a silk blouse that was crumpled up and laid it out on the bed. You come back and some of the wrinkles will be gone. With Meso Botox, we take advantage of the fact the muscles are relaxed, and then we actively get that skin to get thicker, more tone, and younger in structure so that when the Botox wears off, you're more resistant to wrinkling. If you really think about it, you have the same facial muscles that you had when you were 12 years old. The only thing that changes is the skin gets thinner with age. So with Meso Botox, I can take the skin back so it's even more resistant to wrinkling while you have the Botox and even after the Botox wears off.
Okay, so the combination together is much more effective.
And much more effective because you're actually doing something to help improve the appearance by actually physically making the skin younger with the nutrients.
I know we have some before and after pictures, so I want to take a look at those right now and talk about who is a good candidate. Let's take a look at that.
Well, in this particular patient, you can see that she had some very deep frown lines that were causing wrinkling. And then afterwards, you can see that the skin is very, very smooth, and that's just with one Meso Botox treatment.
And how long did it take for that process to happen from wrinkle to smooth?
It takes about 3 weeks. The Botox injection is done at one session, and then we follow up with the mesotherapy treatments, injecting the nutrients directly into the skin and directly into the wrinkles to help smooth those out and build up the skin in those areas.
And here's another before and after picture here. So in 3 weeks you see those results, but how long is the procedure when they come into your office?
When they come into the office, the entire procedure, Debbie, can be done in about 20 minutes. They're in and out and they can go back to normal activity. The nice thing about it, you can actually put makeup on when you leave the office if you have to, so there's virtually no downtime for the patients to get the look that they want.
So you can actually feel the skin, touch the skin, it won't be numb and that type of thing?
No, we use just a little bit of topical anesthetic just to numb the skin for the injections, but that wears off after a while and then it's totally painless thereafter.
So who is a good candidate, do you think?
Anybody that wants to look younger and wants to get rid of wrinkles. Anybody that's ever considered Botox needs to consider Meso Botox because you may actually cut down on the amount of Botox and the frequency of Botox use if you actually can build up the skin.
And how much does this cost?
It generally runs about 20 to 20% more than Botox, depending on the areas. You may spend anywhere from $300 to $500 per area that you would like to have treated.
Okay, so which area, some areas cost more, or does it just depend upon how wrinkled a person is on what you charge?
Right, depending on the amount of medication that needs to be used primarily.
Okay, that was a better way to say it. You're so much more classy. Okay, so talk a little bit too about the side effects. I know you said that, you know, there's a little bit of, I forgot what you call it, where it's a little bit of numbness so you don't feel the needles.
Right. Well, typically, Botox stings a little bit when it goes in, and you may have a little bit of redness. But probably no more redness than if you had a small mosquito bite. That redness goes away fairly quickly. As with Botox, anytime you use Botox, it has to be done by a skilled practitioner. Okay. Because if you're injecting it in the wrong areas, you can have droopy eyelids and other things that are undesirable. So having proper training and doing the Botox technique is also essential for doing the Meso Botox. Okay.
Now, what are some misconceptions out there? Some people may think this sounds too good to be true. So what are some common questions that you get?
Well, the thing that's very important, Debbie, is for people to realize that changes in the human body don't take place overnight. It's a process. People want an instant fix. With Botox, Botox doesn't make the wrinkles go away instantly. It takes time for the skin to smooth itself out. Okay. Meso Botox accelerates that process so that the wrinkles are less visible in a shorter period of time, and they get the faster results that everybody's looking for.
Now, in the before and after pictures we showed the wrinkled forehead. Can you put it around the mouth and around the eyes where crow's feet?
Absolutely. We can use it in the forehead area for the crow's feet. We can use it around the mouth. We can also even use it around the corners of the mouth. Many people start acquiring a little down-turned look to their mouths, and we can also help those areas to help freshen up the mouth and make the mouth look younger.
Okay. Well, Dr. Rodriguez, we're going to come back and allow our viewers to ask you some questions, so don't go away. We're going to take a break, but if you'd like to ask Dr. Rodriguez a question about Meso Botox or laser treatments, mesotherapy for cellulite, for instance, or other aesthetic treatment questions, the numbers to call are on the screen, 214-787-1006, or call toll-free at 888-446-8880. And we will be right back to take your phone calls. Welcome back. We are here with mesotherapy specialist, Dr. Raul Rodriguez, and he's ready to take your phone call and questions. Again, the numbers are 214-787-1006 or toll free at 888-446-8880. We have our first caller, and that's Alan from Dallas. Good morning.
Good morning. How are you?
Just doing great. What's your question?
My question is, can Botox be used to help smile lines, deep smile lines?
That's a very good question. Botox can be used to help smile lines. We can simply inject it into the muscles that cause the creases, and it helps relax those muscles. With the Meso Botox, we can actually then inject directly into that line, directly into that wrinkle, to build up the skin so that it becomes smoother faster and also more wrinkle resistant as the years go by.
All right. Thank you.
How often does the procedure need to be repeated?
Well, I generally have the patients come in every 6 months or so. As with anything, whether it's your car, your home, or your face, maintenance is always easier to do than repair.
Yes, of course. All right, thank you so much.
Thank you, Alan. Now we have Diane from Dallas. Good morning, Diane.
Good morning. I'm thinking that he asked the question I was going to ask. How many treatments does it take to get the effects that you want?
Okay, that's a good question. Typically, you'll have one session. You apply the numbing cream. You come into the office. You have the Botox done along with the mesotherapy in your first session. And for a series of 2 to 3 weeks thereafter, you'll actually come back to the office for the mesotherapy portion of the treatment. And after that, you can go for 4 months, 6 months without having any other treatment while the skin continues to improve and the wrinkles continue to go away.
And you can repeat it over the years as many times as you want?
As many times as you want the wrinkles to stay gone.
Okay, I'm going to be calling you soon.
Okay.
Okay.
Thank you.
Thank you. Let's go to Valerie now and Rowlett. Valerie.
Yes.
How are you?
Fine. How are you?
Thanks for calling. What's your question?
I'd like to know what your skin's like, what happens after the Botox wears off. You know, if you have a lot of wrinkles afterwards, how it breaks down.
Well, after the Botox wears off, your skin doesn't change at all. Botox simply relaxes muscles, and it works well below the level of the skin. The beauty of the Meso Botox combination is that after the Botox wears off, now you have skin that's more wrinkle resistant. so that the effects of the Botox may last longer, you'll look wrinkle-free for a longer period of time, and your skin will actually be healthier.
Oh, fantastic.
Okay, thank you.
Thank
Nancy and McKinney, good morning.
Good morning.
Okay, we have you there. What's your question?
I have heard that the Botox is very addictive, and that once you have a treatment, that you have to have the treatment continuously. Is this true, or is the new treatment kind of make that different?
Well, Nancy, in terms of the addiction potential, depends on how vain you are. The more vain you are, the more addictive it can be. No, there's no really after effects of Botox or the mesotherapy treatments. It's just a matter of how long you would like to be able to keep the skin healthy and wrinkle-free. Some people may require it more than others. For example, people that may be exposed to sun more often or may have more sun damage may require treatments a little bit more frequently or more aggressively than someone, let's say, that stays indoors all the time.
Okay. So
Does that answer your question?
yes, it does. But the rest of that question is, so you don't have to have them more often?
No, some patients have the Meso Botox combination done just once. And when they like the look, they may go for a year, maybe 2 years, and then come back whenever they start seeing that the wrinkles are getting a little bit deeper or more than they want to look at, and then they'll come back and get into the treatment. You're not required to have it every 4 months or every 6 months. It just depends on the patient and the look that the patient wants to get as they see the wrinkles developing.
All right, thank you very much. So in other words, your skin, there's not going to be some side effect where your skin is going to feel a certain way and you feel like I've got to get Botox to make this go away.
No.
There's nothing like that.
Once it wears off, your skin is not going to just all of a sudden sag or anything like that. So that's not a concern
it's really
whatsoever.
Just up to the individual.
Right.
Let's go to Velma in Mesquite. Velma, good morning.
Good morning.
Hi, what's your question?
Okay, I would just like to ask Dr. Rodriguez if how safe is this procedure? Would he recommend it to one of his family members?
How safe is it? Would you recommend it to one of your family members?
Well, as a matter of fact, I do have family members that are getting the procedure. And the nice thing about these treatments is that they can be done in the doctor's office and they're very, very safe with very little side effects.
Okay, you say very little side effects. If there is a side effect, what is that?
You'll have a little stinging, a little redness right at the point where I did the injection.
Okay.
And that's about it.
All right. Chris in Plano, good morning.
Yes, good morning.
Hi.
I was wondering what kind of practitioner you go to have these treatments done, what kind of licensure, what your particular education is, and do dermatologists do this? Is this medically acceptable treatment?
Well, yes, it is medically acceptable treatment. Mesotherapy is a new technique, and I've been involved in training doctors throughout the country about the past 3 years or so. I've trained doctors in all specialties, from dermatologists to plastic surgeons to other doctors that have an interest in aesthetics, such as anti-aging doctors. But the important thing is to know that the doctor has had the training in the technique. It's important to ask what medications are used. Is the doctor using FDA-approved products here in this country? All those things are important if you're looking at the safety standpoint.
Okay. So when you walk into a doctor's office, will you see a certain certification, or you have to ask those questions?
Well, we're currently certifying physicians through the American Board of Mesotherapy, which I'm one of the members of the board. And it's a certification process that we have in place now. We're going to be giving examinations for the first time in the fall of this year.
All right.
For certification.
Well, I think it's outstanding that you're training doctors all around the country. So
yes.
Congratulations to your success.
Well, thank you very much.
I appreciate you coming in and answering those questions.
Well, thank you for having me.
All right. And being so honest, his family members have done it too. So if you would like more information about Meso Botox or other mesotherapy procedures, we didn't get to get into it, but you can get cellulite reduced and removed. You can log on to Dr. Rodriguez's website at rejuvenexmedical.com. Scott?
There's a such thing as an anti-aging doctor?
There are doctors that specialize in anti-aging medicine. They do hormonal replacement and things like that. And many of those, as an adjunct to that, are looking to mesotherapy as a more natural way to enhance people's appearances, as they also help take them back in time through their anti-aging treatments.
I'll have to check that out.
Okay.
Thank you very much. Thinking of pampering